Good morning, everyone. My name is Gino Herdias, and today I'll be talking about Tanzania. So Tanzania is a country situated in the east coast of Africa. So when we talk about the statistics of Tanzania and the Philippines, you can see that there is quite a big difference in terms of GDP and GDP per capita. So we see that Tanzania has current GDP of 45.63 billion, the Philippines with 292. GDP per capita, there's also a stark difference with 2,600 and 7,300. Population, Philippines is twice as big. And you see HDI, it has a closer comparison with 0.5 and 0.6 respectively. And their HDI rank 151 and 116, so another big difference. What's interesting for me here is that GDP growth for these two countries has been consistently strong over the past few years. The Philippines and Tanzania, this is 2015, so Tanzania grew about 7% in 2015, and the Philippines 5.9% in 2015. So consistently, they have been growing at around 5 to 7%. So let's see at what contributes to this high growth rate in Tanzania. Actually, I'd like to focus on just one aspect, and that's the aspect of HIV and AIDS. Now, you see, HIV and AIDS was a global epidemic that affected over 70 million people, and 70 million people around the world, and caused about 35 million deaths. That's the same size as the whole of Malaysia. Actually, 5 million more than the whole of Malaysia. See, in Tanzania, the HIV epidemic peaked at 1997, affecting 8% of total population. So what does that mean to their statistics? Well, life expectancy, 1995, was 48 years old. 48. My parents are 53 years old. That's way above their life expectancy. And my parents are still, active and kicking and very energized when they get mad at me. But you can see here, if they lived in Tanzania, they're already the outliers. And that's a big thing. It affects so many people. And see, HIV is an immune system disease. It breaks down your immune system so that you're more vulnerable to diseases such as tuberculosis, malaria, and when it develops into AIDS, even a common cold can be deadly. Let's see how Tanzania dealt with this problem. As we can see, there's a sharp decline, and Tanzania is one of the countries that have had a stable decrease in HIV prevalence. So their management of this disease is pretty good. So first, medical interventions. We know that improved access and improved treatment has helped the Tanzanian population. So this was studied by Groscu et al. In 1995, and saw that having improved health facilities near towns reduced HIV incidence by 40%. We also know that the effectiveness of condoms as a means of prevention of HIV. In 1997, a study estimated that consistent condom use is 90 to 95% effective in preventing HIV. But it's not all about the institutions. We also have to, we learned about institutions here in 191, and we know how important they are. But we also have to focus on social and cultural interventions. And this is where I think Tanzania made a step above the rest. See, in this 2009 study, they, with a cohort of 1,933 individuals, they found out that 58% of the population did not agree that HIV/AIDS is a punishment for sinning. So there's a misconception that HIV/AIDS is not your control. There are misconceptions and stigma about HIV. So they found that these indicators here improved, or rather heightened, the incidence of HIV. Those with less primary education, those who experience intimate partner violence, those who did not have a choice to use condoms in their relationships, and those living in the rural areas. So you can see the odds ratio indicated there, and all are significant in the 95% level. Also, the study by Mbala and Allen in 2002 showed that to address this concern, this cultural concern, they used participatory action research. That means they went into towns and they tried to teach, or they tried to involve the participant with knowing more about HIV. So they quelled such stigma or traditional norms, such as the coming out celebration, where female children in the tribe were consistently encouraged to have more sexual partners. The same with lingo, which is a cleansing ritual, wherein women who were not, who without partners were seen to be unclean. And the indi, or rite of passage of teenage boys, where they were encouraged to have sexual intercourse right after circumcision with as many partners as they have. So these are cultural norms that maybe in the past were there to address maybe a population issue, but now has been outdated and has been the cause of this rising trend in HIV. Same with the entertainment education and HIV prevention, a study in 2012. They found that the radio soap opera, Duende de Wakati, reduce the number of sexual. This is soap opera that deals with addressing HIV, and their study shows that it reduces the number of sexual partners, it increases condom adaptation, increases the self-perception of risk of HIV, self-efficacy when preventing HIV, and interpersonal communication about HIV. So it's important that we break this stigma that HIV is something bad, that's something that we cannot control. And of course, to bring up the discourse into a formal level. So why is this important to the Philippines? We saw in the graph earlier, if you remember, here. HIV prevalence in the Philippines, way below 1%. But in 2012, the Philippines was one of 7 countries where the global number of new HIV cases increased 25% from 2001 to 2009. 1 out of 7 countries. Out of all the countries with declining HIV rates, Philippines is one that bucks the trend, increasing. 2016, 1 of 74 countries with increasing rates of HIV. So this is a very dangerous and very pressing concern. You can see there here in the Philippine map that most of the cases are concentrated within the NCR region. So let's see the Philippine context. This is number of HIV transmissions for the Philippines from the year 2014 to 2015, a 34% increase. Now, Tanzania, within 5 years, decreased their HIV incidence by 20%. The Philippines, in just 1 year, raised their HIV incidence by 34%. Average increase in the last decade, 29%. Modes of transmission, as we can see here, I'm not sure if you can see the line, but the orange line, which presents the highest mode of transmission of HIV, is male-to-male sexual intercourse, followed by male-to-female sexual intercourse, and then by IV and drug use, sharing of injections. The number of, this is transmission, and this is the number of reported HIV cases. So again, a large increase. The 2016, that's just only from March. That's March compared to the whole year, so that's why it's less. Now, even with these statistics, we know that these are grossly underreported. The actual cases of HIV and AIDS here in the Philippines is way more than what these statistics show. And why? And we can see here that the age distribution, where blue is the youngest and the top violet is the oldest, is becoming more and more a younger person's concern, our concern as young adults. And it's become more of a male concern. So the blue here represents the percentage of males affected, and the red females affected. So why is this? Because of we have passed the RH law and we have an RA about sexual education, but these aren't being implemented because of our cultural inhibitions or our cultural nature. You see that the use of condoms, the teaching of sexual education has been widely opposed by church groups, senators, even the Vice President of the Philippines has spoken out against the condom use. So we can see in the culture of, in the context of Tanzania, one of the main aspects is to tackle this negative stigma, this cultural aspect, because it's behavior we're trying to change. Yes, we need institutions, but we also need to affect behavior. So that's it. And